Hello, and welcome to the Transform Wellness Clinic. I am Dr. Bradford Perkins, and today I'm going to talk about personalized medicine for wellness, performance, and longevity. This is my Concierge program. In today's medical landscape, there's a lot of complaints that I hear. They feel that they're not being heard. Patients don't see there's any personalization to the recommendations they're receiving. They're just given a prescription and rushed out the door. There's also time constraints where they might only get 5 to 10 minutes to talk to their doctor, but have waited 2, 3, 4 months for that appointment. So there's a lot of dissatisfaction in our current system. And that's where Transform Wellness comes in. Just like any concierge practice, you have 24/7 access to me. You get same day or next day appointments. And in general, appointments are longer. Appointments are anywhere from 30 minutes to 60 minutes, even 90 minutes on occasion. And then what makes me different than other concierge practices is that I take a holistic, integrative approach to medicine. I really focus on lifestyle changes before doing any medications. So I look at, sleep quality, stress, nutrition, movement, all of those aspects to make sure we're coming up with a holistic plan for my patient's care. This is about me. I'm born and raised here in San Jose. I've worked in Los Gatos since 2007. I founded Transform Wellness Clinic in 23 because I just saw the way medicine was going and I felt I needed to make a change in my career to really help my patients. I am a family physician since 2007. I became an obesity medicine specialist in 2023 and I'm a fellow in anti-aging medicine. So here at Transform Wellness, we do have a mission statement. I want to provide personalized care that addresses the core drivers of health, enabling patients to optimize their health span and well-being through evidence-based solutions and sustainable lifestyle changes. So, I've seen many patients over the years, and, these are some of the things that I've heard. He truly takes the time to understand and get to know his patients and their symptoms and work to create a full picture to get all the data needed to assess and make a plan. And this is another one of my patients saying that he goes the extra mile to help diagnose any problems health-wise and personal. And that's really my goal. I want to make sure I'm giving the best quality advice that I can give. But, with concierge medicine, unfortunately, there is a membership fee. And these are the common objections that I hear. The first one's, I'm healthy. I don't think I'd use it enough to justify the cost. For that, the value really is in your long-term health. Even if you feel you're healthy, there's always things we can work on. I'm going to look at functional medicine testing, your hormones, make sure everything's optimized to really improve your health span. And, the next one I hear is, isn't this for the wealthy? That's not really the case anymore. In today's environment, our health is really our long-term currency. It's better to put the money in and invest in your health before you're sick so that you don't get sick. Because once someone is sick, the cost of being sick goes way up. The next thing is I don't need to see a doctor that often. I only go when something's wrong. With that, again, this is focusing on improving lifespan and health. And we're really doing a deep dive into your overall health and make sure you're optimizing your lifestyle. And then the next one, it says, it feels like I'd be paying for something that should already be part of healthcare. Yeah, it should be part of healthcare. But unfortunately, that's not how it is or where it's going. I have seen a big change in the last 10 years where most of the private practices are gone and everyone's part of big medical groups and everyone wants things done the same way. Everything's being streamlined, but that is making patient care worse and quality is worse. And then the last question is, what if I need a specialist or lab work? I know plenty of local specialists that I refer to. And for lab work, I just send to the regular local labs for the most part. So, when you look at traditional medicine, usually it's treating symptoms. You're looking at prescription drugs. It's a one-size-fits-all system, very reactive with limited time and availability, which here at Transform Wellness, That's not the case. We look at prevention, performance, try and get to root cause if you are having any symptoms. We focus on lifestyle changes and cellular healing. It's very personalized. Every patient is different. I take a proactive, holistic approach to make sure you're looking at your long-term health, not just if you're sick now, but are you going to be healthy in 20, 30, 40 years from now? And then don't have time constraints. Appointments are just longer. We can make them longer if we need them because the goal is to get you to optimize your health. So what are the drivers of chronic disease? So it looks at your cellular and metabolic health, and that's getting down to those little mitochondria we learned about back in biology class in high school or college. Hormone balance, not just your testosterone or thyroid. We're also looking at estrogen levels for women, especially if they're becoming perimenopause and in menopause. We're looking at your cortisol levels, and those can be elevated with chronic stress, which is probably the number one driver of chronic disease as far as hormones, that and insulin. And then an unhealthy gut environment. So we really look at these three areas and delve into how we can help repair them. The lifestyle changes we look at are sleep, so sleep quality and quantity, nutrition, focusing on protein intake, healthy fats, limiting processed foods. We talk about movement and exercise, not just having an exercise routine, but that day-to-day movement. Focus on stress and mental health, looking at your habits, and what are your social connections? That's that one we kind of forget to talk about. It's very important to be connected to our environment, other people. So, a lot of times people will just start to isolate themselves. That leads to more illness. So making sure you have an outlet, having a purpose. One of the first questions I ask is, what is your purpose? Not work purpose. What is your life's purpose? Very important question to know the answer to for anyone trying to figure out where they need to go. When patients struggle answering that question, it's really the first thing we need to know to really get a whole person, whole health way to heal somebody. So what's included in the membership? So like we said before, same day or next day appointments, you get longer appointments. Dependents are covered in the membership fee. There's care given for visiting family members. Here in the office, I do have a body composition scale that we do. I have a 3D body scanner if people are interested. We can do resting metabolic rate testing with an indirect calorimeter to understand someone's metabolism. As far as testing, I really think tests are very important to get an overall picture. So I do a lot of advanced metabolic, hormone, and lipid testing. I do advanced cardiac screenings for asymptomatic people, looking at either calcium score or CT angiogram. For certain patients that I feel that a full body MRI is warranted, I do order Prenuvo full body MRIs. And again, what makes me different is I do functional medicine testing as well. So I will test gut microbiome if we need to, urinary hormones, toxin burden, food sensitivities, genetic testing. So we go through all this on an individual basis. So, here's me in my office. You can see my posters. If this is something that you're interested in, please give my office a call, and I hope to see you soon.